Inhealthcare is a software business, so we operate a software platform that allows the NHS to monitor patients within the comfort of their own home. These days there's a lot of noise coming from the NHS about virtual wards, but they're just a subset of the whole remote patient monitoring services that we've been offering now for about 6 years. Remote patient technologies and digital health in its own right has really started coming under the frameworks done by the MHRA. So a medical device, in the same way that an implant might be a medical device, the MHRA are looking at how they govern the safety and consistency of digital health platforms, and Inhealthcare is currently registered as a Class 1 medical device, and we're moving through into Class 2 in terms of the frameworks that monitor the safety of services that we deliver. Virtual wards and remote patient monitoring in general are all about patients taking various vital signs, which could be their weight, their blood pressure, their blood oxygen level, their temperature, within the comfort of their own home, so not having to go to hospital for having these readings taken, and not having to have a community nurse come round to do this for them. Now, in recent times, over the past 6 to 12 months, virtual wards as a terminology has come as a way of easing capacity in hospitals, so allowing the early discharge of patients who don't need to be under the constant supervision of the care team in close proximity to actually being discharged to their own home and getting out of hospital, where most of them want to be. You want to be at your own home and taking these readings themselves. What we do in that scenario is our software prompts the patients to take the readings. It takes the readings from the patients and then presents them back in a dashboard format to the care team, who are remotely monitoring their patients and intervening only when necessary, as opposed to intervening every time and seeing people who don't need to really see a healthcare professional. Now, if you think one of the biggest challenges the NHS faces, and they talk about a staff plan, a 10-year staff plan, there's the talk now of a productivity plan. So getting these staff working in a more productive way and using technology to support that increase in productivity. The benefits, obviously, patients don't have to go to hospital, they don't have to travel. The providers don't have to go see the patients. And in terms of virtual wards, it should empty hospitals, not empty, remove some capacity out of hospitals to get people flowing through A&E and into a bed when they do require it. And then there's also, and this early days in how they're monitoring this and measuring this, is the NHS is legally obliged to go to net zero. People not travelling is a big contributor. I haven't got the stats to hand, but it's a huge amount of travel involved, either patients going to hospitals or a district nurse, shall we say, going to see a patient. If you can cut out some of that travel, it all helps move the NHS to its legal commitments of net zero. We made a conscious decision as we were building our platform in not restricting patients to using an app, shall we say. So obviously you need a device to take the readings, a blood pressure cuff, a set of scales, a thermometer, but we give patients choice on how they can give them readings back into the data. So we do an automated telephone call, which people think is really old-fashioned. But if you imagine now with Alexa, it's all about voice recognition, things like that. People are comfortable using the voice. Doing this is not your natural behaviour. So we do automated telephone calls, we do SMSs, of course we have an app for smartphones and tablets, and we also have a way of initiating either a video or a telephone call if a patient is concerned, so they can do it that way as well if they're really not. So it's a fully inclusive way of measuring patients, and it doesn't rely on them to be tech savvy. It's been like 99.9% of all homes have got a telephone or access to a telephone, so they can use the telephone if they wish. SMS, the coverage is not too bad, particularly in urban areas, but in rural areas around Harrogate itself, there's black spots, so individuals can use a telephone to communicate with the patients if they don't have decent broadband or mobile coverage. The platform's used across the UK, so we were really proud back in 2022. After a formal tender process, we were chosen as a national platform for Scotland. So right across Scotland, our services are being rolled out, and we're very strong in the south east of the UK. We built a COVID symptom tracker, a virtual ward for people suffering from COVID, to allow the NHS to intervene with people who are exacerbating. And during the peak of COVID, or through the pandemic, we had just over 25,000 people go through that service. And that was at a time when, particularly in the south, the NHS was on the brink of collapse. There was no capacity whatsoever. So we were allowing people to, allowing the NHS to intervene in a more timely manner to prevent access to a hospital, rather than when it was too late, when people's blood oxygen had really dropped off and they ended up in intensive care. Everybody has a different way of doing things, different operating procedures. There's no national service as such. It's guidance and guidelines, not mandates. So we were allowed to, I was really pleased at the time. From initial commercial engagement through contracting through deployment was about 8 weeks for a brand new service, and I think it was testament to the hard work of the NHS organisations that were pulling it together, the rigid project management, but my team who really put a lot of effort in. They were all working remote at the time, as most people were, to build this service that made a real difference to the NHS, but more importantly to patients who were using the service. As COVID became less of an issue, particularly in the south, the teams that were using our services realised they could adapt them to other areas. So one of the areas that would service that we built for one of our customers down in the southeast is for the oncology team. So when they came to, I'm thinking, how can we help with cancer? And it's for people who are on chemotherapy, whose immune system is really low. They don't have to leave home to go to hospital to have their vital signs checked. It can all be done remotely. And again, so the infection, the benefits are multitude. And COVID for the industry was a pivot point in terms of, whether it's video consultations through to remote patient monitoring. The NHS adapted, and they had this spirit that, this COVID spirit of getting things done. But they learned from that, and the teams, another area, they've adapted what was a COVID service to do hypertension. And we talk about COVID and hypertension. I saw some stats the other day, a presentation by a cardiologist from Papworth, and I think globally there was 560 million COVID infections, which led to 6.3 million deaths over the pandemic period. In 2019, which is the last time they got proper stats, globally there's 500 million people with cardiovascular disease and 80 million people died. So it's a much bigger problem than COVID, and we're seeing our technologies being used for managing hypertension, high blood pressure, managing stroke detection and managing heart failure, because I think the stat that came out is 1 in 4 people in the UK die from a cardiovascular related illness. So we've seen our technologies being adapted into that marketplace. So the legacy of COVID for our industry and the benefits to the patients is going to be huge. The platform is solid and mature, and it's got all the integrations into NHS systems, so it's not a standalone silo and it's not an app and things like that. It's part of the system, as they call it. But one of the things that we found from our customers is they've realised that we're creating a massive amount of data. So recently we launched a data analytics and reporting service for the insight. So you've got the operational or the care type data, which is presented near real time. We send an alert if someone's thresholds have been breached. But then you've got the operational data that sits behind that and how you can improve how care's delivered. So I think we're measuring around 2,500 different data points across all our services. And so we're building a huge amount of knowledge which can then be used to as I say, improve how care is delivered with technologies. And these are the bases, and I hate using the term artificial intelligence, but without the data points and the massive amount of data that we're creating, as I said, we have 2,500 data points being measured. We've had around 3 million patients activations over time. We can learn from that, and machine learning as they call it, and things, and how you improve things, and looking at population health and stuff like that. So we can see, you know, we can compare Scotland's blood pressure to the South East blood pressure, just that type of thing. And I'm not a data analyst, so I don't know where that's going to go, but without the data in the first place, you know where to go. But people who are data analysts, particularly in the NHS, can really start getting some insight from this data. In our install base, they've repurposed, as I've touched on before, technologies we had for COVID symptom tracking to respiratory type services. So we've a respiratory service rolled out across the south of England. Outside of NHS England, where you've got Scotland and Northern Ireland, they're looking at respiratory services as well. They're not part of the NHS England targets, but they've got their own aspirations to discharge people from hospital early, but also they call it step up and step down care. So step down is when you discharge people early. The step up is preventing people getting to hospital in the first place. So when I showed you the virtual ward dashboards and things like that, that's to prevent people being put into hospital. There's a huge amount of activity now within NHS across England on procurement of virtual wards. So that process started around January, I would say, in earnest. So there's a number of tenders that we're working on with some local providers, but further afield as well. We monitor over 100 different conditions within patients, or support patients in their healthcare journey. And that can be something really simple, from prompt type services around smoking cessation, right through to complex respiratory virtual wards, which are monitoring 5 or 6 different key indicators, creating something called what's a national early warning score, news score as I call it, and alerting or not against that. So it's been adapted by forward-thinking clinicians on how they can use these capabilities to deliver care for their patients, for their particular specialisation. And the way that we do that is, as I mentioned, we've got the core capabilities in the platform, but then we have a really easy to use toolkit that allows us to create these services rapidly to a customer's requirements. And that's where we're seeing the interest in our platform, and how people can adapt digital health for care in various different disciplines. We did some research last year and decided to go with an organisation called Snowflake, who are a leading provider of data warehouse services. So we spent some time building that to our customers' requirements, and this allows people to do deep analytics as opposed to just getting reports. So most people who say they do reporting, data reporting, things like that, they export an Excel spreadsheet to the NHS and hope that someone's got the time, whether it's at NHS Digital or within the local ICB, to read that. We're actually giving them proper tools that they can either integrate that into the existing, if it's a more mature hospital, it'll have some sort of business intelligence services. So we integrate our data warehouse into their business intelligence services, and they can self-serve and get what information they require, or they can work with us to create reports that add real value to and give them real insight into the services that they're delivering and the benefits that they're bringing. We created 20 new jobs. They were actually created, but the news didn't come out at the back end of last year, as we were worked with our customers to repurpose some of the services that we were delivering. So using the toolkit, shall we say, a lot of these people to build these new services for the NHS. So that in effect was doubling the size of the business almost. And they were mainly technical type roles. In fact, they were all technical type roles that we brought in, technical and support. In our view, without remote patient monitoring, there's no way the NHS can address the productivity issues that they face. They've got exponential growth in demand on services. You can't keep chucking people at the problem. They just can't find enough staff. So you've got to get the productivity, and the productivity is around only seeing patients that need seeing, not seeing the ones that are okay and come back. It's our firm belief that the NHS needs remote patient monitoring to address its productivity issues. They cannot recruit enough staff, demand is going up, and using technology so that they're only seeing patients who need to be seen is an easy way of improving productivity. And an example I'd use, I touched on earlier about cardiovascular disease. So there's 8 million people approximately have got high blood pressure. So if they went to see their GP twice a year, if you got 10% of them on a remote patient monitoring service, so the GPs would only intervene where necessary, that would save something like 1.6 million GP appointments. So there's a lot of noise because it makes good headlines about A&E being full and ambulances queuing outside the A&E departments, but a big pressure on the health service and a big source of public dissatisfaction is trying to get a GP appointment. Now we all talk about getting on the phone at 8 o'clock in the morning, etc., etc. If we could free up with just 10% of the patients with high blood pressure, 1.6 million appointments. That's a lot of GP appointments, and you extrapolate that out, it could be huge. I think we did some stats which 10 services with 70% of the population using these 10 services, it saves something like 140 million appointments in the NHS, and they're the productivity gains you can get from remote patient monitoring. Inhealthcare is part of the Technology PLC group. We relocated to Harrogate from Leeds back in 1999. We did this mainly because there was a piece of infrastructure that we wanted to, I hate using this word, but I can't think of a better one, commercially exploit. i.e. there was a redundant data centre that used to belong to National Power, and we were getting into what is now called cloud computing. So we took over that facility, we moved our computer distribution business alongside that up on Cardale Park, and we revamped the data centre, brought it up to modern conditions, and built a business around that called Technology Managed Services. And then we had Technology Distribution, sat on the same campus, which was at the time, a £300 million pan-European distribution business. That was acquired by one of the big global companies back in 2006, and it's still up in Harrogate, still quite a large employer, I would have thought. And our data centre business, we sold to a company called Red Centric back in 2013. So we could focus in on creating our own IP, i.e. the software development that we've been doing, along with one or two other ventures that we've got running. We've currently got 3 businesses as part of the Technology PLC group, all tech businesses. We've got Inhealthcare, we've got WeLink, which does domestic wholesale broadband but delivered over Wi-Fi rather than having to dig your garden up to put a bit of fibre in, but it gives you the same 1 gig speed. And then we've got Mobile Tornado, which is an AIM-listed organisation that provides solutions based around push to talk and push over cellular, so using your mobile phone in the same way that people used to use two-way radios, but with it being digital and a software-based solution, you're getting all the functionality and the insight and the workforce management tools that sit above a two-way radio. So what makes Harrogate a good place for Inhealthcare to be? We obviously got our legacy of our staff as we've built there, and I think people who come and live and settle in Harrogate or who are born in Harrogate tend to like this environment, so we've got a good stable workforce. As we've expanded the business, we've been able to draw on people from the cities that are around Harrogate, so Bradford and Leeds, where we can get people to come and commute in, and some have relocated to Harrogate. It sounds a bit trite to say, it's a nice place to come. You're not coming into a big city, but you've got everything you need in there. You've now got communication, so the guys can, if they need to be in London or the south, they can just jump on a train in Harrogate, be there within 3 hours and things like that. So the communications are improving, and the council have been pretty supportive. When we first moved up here in the late 90s, as I say, they supported us to create with the work we needed to do to bring our distribution business up here in terms of building a warehouse and things like that. So they've been supportive of us through our journey. We were probably one of the early adopters of being in the tech sector, and we have seen organisations that we're quite proud of, where former employees have gone off and built their own businesses and doing really well for themselves. So I think it does build an ecosystem that's coming out of there. I think from my sector, people talk about the digital sector, and people think about computer programmers. But it's more than that. As you know, you need all the design people, the user interface people, the marketing people, compliance people, legal people. So you start building, and I know the hospital and the council are working hard to try and crystallise this ecosystem that have been built into some form of innovation hub that is more than just the likes of Inhealthcare with a load of computer programmers. It's the entire ecosystem needed to deliver solutions, and that applies to other areas in the tech sector, whether it's fintech or whatever. You need the knowledge around it to succeed, and it even stretches down, I guess, into the VC that's in there, or private equity. So you've got access to funding, you've got access to knowledge and skill sets, as well as a labour pool to drive your own business. And as I say, the council and the local hospital are trying to crystallise that into something that they can build on and use. Success breeds success, doesn't it? So if you're bringing in people who are bringing services to serve the people of Harrogate and North Yorkshire, then they bring in other support organisations to help them, whether it's a set of lawyers with the contracts, or, as I say, they want to do some digital marketing or things like that. And then you get into the collab type environment where people can build these relationships. It's starting obviously informal, but entrepreneurs tend to bounce off each other, and one is usually more than two, isn't it? If you're thinking of coming to Harrogate, or you're setting up in Harrogate and you don't want to be stuck in your back room, give these a try. It's a short-term commitment. Come down, have a look at it. If it's not for you, it's not for you. But you probably find that it's an easier way to build up a network of like-minded individuals that complement the business you're trying to build. If you look at people who are coming here and want to build a life here, so not using it as a stepping stone, so you've got green open spaces, you've got great schools, you've got diverse high street, but you've also got all the big national chains in and around that you need, in terms of supermarkets and things like that. It is an absolute genuine gateway to 2 national parks. And if that's a lifestyle that you want, which is fresh air, openness, and all the well-being things that brings, not being stuck in a city, Harrogate is a place for you. People who come here and bring the kids into the system and stuff like that, I see it in my staff as I bring the kids up through the schools and so on and so forth. They absolutely love living here. And in the past, people had to move from Harrogate to succeed. They felt, they had to go try it in London. That's no longer the case. One of the things, with home working and things like that is you can get a London salary and live wherever you want in the country. And if you want something, that's not a big city, but it's got everything you need, plus all the benefits of being, as I say, in effect in the countryside, this is the place. The college is doing really well. I mean, I've not utilised it as much as I would have liked. I would have, pre-pandemic we were looking at building an academy and taking people from the college and trying to morph our own teams and things like that. The pandemic put a pause on that because we couldn't think about how we could do the mentoring and bringing people through with face-to-face education that they'd need within our organisation. But you know, between the schools and the college, there's a great local talent pool. There's universities in Leeds and York, and as I said, people who graduated from these places in the past tended to go to the big cities, and they don't need to now. There's local businesses employing, and there's also the chance to work for these big national companies. You know, whether they're down in Leeds or down in London, they've got a flexible working policies now, so you can have, as I said before, all the benefits of working for a big national if that's what floats your boat, but in an environment where you've got great schools and great facilities. I first really engaged with the council in a structured manner when they were looking at the place building around Harrogate back in 2019, when they were trying to bring like-minded businesses to promote not only the work-life balance that we touched about, what a great place Harrogate is to live and bring up a family, but also the fostering the promotion of Harrogate as a place that's good to do business and come in. And so that was impacted a little bit by the pandemic, but as we're coming out of that, things like the CoLab that we're in today and the offices that are supporting that, you know, they're looking at ways of how they can bring the entrepreneurs of tomorrow on that journey. You know, their first step on the ladder is, as I say, you know, an environment that's not, you're not stuck in your back room working by yourself in isolation or on chat rooms and things like that. And you know, we all need some interaction with as a race of people. We're not really lone wolves. I've tried to share my experiences with people who are looking to coming into the area and the sector in itself. The sector is becoming mainstream. Maybe 2 or 3 years ago it was very much fringe, but it's accepted now as digital health and remote patient monitoring, everything that goes around that is the way forward. And you know, so obviously the councillors as such are working with the local NHS bodies to try and make this an attractive place for entrepreneurs to start their businesses and move things forward. And as I've touched on, that there are the support infrastructure around that, as I said, in terms of professional people, accountants, lawyers and things like that. There is an ecosystem that's around there already that people can tap into. And then the other areas, as I touched on, around digital marketing and all that's entailed, whether that's just a website, whether that's really sophisticated search engine optimization and things like that. We use a local company for our type of services. So these all success breeds success, doesn't it? My favourite thing about being in Harrogate, I love the green space. So I'm not allowed to go to Betsy's, so I'll stick on the green space and you know the wildlife that's just over there. It's on the horizon. It's not over the horizon, isn't it? So the Dales are one of my favourite spots in the world. So and they're just up the road.